In this video, we'll be debunking the myth that biopsy of a cancer causes it to spread. It is a very common scenario in our clinical practice when a patient comes to us and says that, if I get a biopsy done, the cancer will spread. Or somebody did a biopsy and my cancer started growing. It's a very, very common thing to face in a clinical practice. But is it a reality? The fact is, cancer is not known to spread because of biopsy. It is like telling that the crow sat on the tree and the tree fell. So, usually the problem is that the cancer will be taking its own course. Whether we do biopsy or not, the cancer will progress in many situations. So, what is more important than talking about biopsy in these scenarios is that we talk about treatment of cancer. It all depends on the stage and diagnosis of cancer, how the outcomes will be. Now, coming to the core issue of biopsy itself, what is the evidence? The evidence is very clear that the biopsy itself does not spread. There has been enough research on this. There is absolutely no evidence to say that it does spread or it causes any trouble in the tumor itself. Now, there are certain types of cancers we do not recommend any biopsies. I'll give you those examples or I'll tell you what those are. There is gallbladder cancer. Gallbladder is like a bladder. It is like a fluid-filled cavity. So you do biopsy, it can spread cancer. Ovary, because it's again a balloon-like structure. There is fluid inside it. So you put a needle, it can spread. Kidney, we never put. We do a diagnosis based on the CT scan alone. This is because if you put a needle into the kidney, it can bleed. So there are some unique scenarios where medically we do not recommend a biopsy at all. But apart from these, most of the scenarios we need a biopsy in order to prove that it is cancer and make an overall planning for the management of cancer. It's an essential component of cancer treatment. So we cannot avoid, in more than 70 to 80% of the cancers, we cannot avoid but do a biopsy. So in this video, we have debunked a very common myth, which is an internationally spread myth, that biopsy of cancer can spread it. Thank you.